The ICF Training and Technical Assistance Team is honored to welcome you to this California Housing and Community Development Training session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services Contract. I'm Chris Pitcher from ICF, and I will be hosting today's session. Today's training session is part 2 of our effective non-congregate shelter. Specifically, we're talking about prioritization today. It is my privilege to introduce our first presenter, Ashley Kerr. Ashley.
Hi, everyone. Thanks so much for being here. I know a few people are trickling in. I'm really glad to be part of the conversation. Next slide, please. So I'm going to talk about our agenda today. We are obviously going to do brief introductions of myself and Nora. I'm not sure if our colleague Donald has joined us yet, but he will be here for later in our presentation. Just a quick recap of session 1 about what non-congregate shelter is and why we are promoting it as an intervention. Talking about prioritization for non-congregate shelter after the COVID emergency ends. Obviously, there will be fewer resources out there for non-congregate shelter, and we want to talk through what communities can talk about as they think about prioritization. And then we're going to do a brief community highlight from Colorado's Coalition for the Homeless. We have some information from them. They were not able to join us today, or they are not able to join us today, but we have the information and would love to share that with you all and can connect you if you want more information. So, and then hopefully we will have a couple of minutes for Q&A. Next slide, please. Okay, just a reminder, my name is Ashley Kerr. I use she, her pronouns. I am a technical assistance provider working for ICF and have been doing work in the homelessness and vulnerable population space for 15 plus years, primarily in rural areas, and just have been really excited during this conversation to talk about non-congregate and why I think it's a really terrific intervention for shelter and a really good way to reimagine shelter. Nora?
Hi, everyone. My name is Nora Breslin, and I work for Home Base. We're a nonprofit based in the Bay Area, and we are partnering with ICF on this project to run some of these trainings that you all have been coming to. We also do a lot of direct one-on-one TA, and I've done that through a couple of contracts with HCD as well. So often I recognize some of your names on this call. So glad to have you here today. We have a third presenter, Donald, but he had a little conflict at the beginning of this meeting, so I think he'll be joining a little bit later, and we'll let him reveal himself at that point.
Like the Masked Singer.
Exactly.
All right, next slide, please. Okay, here we have our first question. Kimberly, if you'll be willing to launch the poll. We are just trying to figure out who all is in the room. I see that you've put some of your information in the chat, but would just love to know what all is, if there's others in the room. Okay, it looks like only one. Let's actually, I think we can close up the poll, Kimberly, and maybe show the results. Great, thank you. So we have some shelter providers, a lead agency, some housing providers, and also the other, which is a much larger group. I see we have some consultants and some other folks. So really happy that you are here and joining us today for this conversation. So as a reminder, what is non-congregate shelter, or NCS as we've been referring to it? It is a living space that offers privacy. So examples for this include hotels or motel rooms, dormitory style buildings, retreat camps, decommissioned nursing homes, or other buildings that have private rooms or the ability to create private rooms. And under the Emergency Solutions Grant, which is really what we've been focusing on in this particular session, that the hotels and motel rooms are an eligible expense. They were used pretty sparingly prior to COVID-19, but once the pandemic hit, really we put as many vulnerable people as possible into hotels and motels. And It's been super helpful. We have some really good initial research about why it has been really beneficial for people to be in non-congregate shelter. And we will talk a little bit more about that in the next slide. So it minimizes trauma. The idea here is that the way we have been sheltering individuals in this country has really become institutionalized. Individuals stay in really large rooms with lots of other people. They're often in bunk beds, and people have to share restroom facilities. People are told when they can eat and shower, when they can leave, when they have to leave, when they can come back. And it has really disempowered a lot of the individuals that we are trying to serve who are experiencing homelessness and a number of challenges. And it is incredibly traumatizing. So the idea here is that non-congregate shelter, or the ability for people to be in private areas where they can decide when they shower and use the bathroom, decide when they want to leave, decide when they want to sleep. It's a much more humane approach to sheltering. It also provides a different level of safety and security for individuals. So we know, and we say this on the last bullet here, but also Nora spoke about this in session 1, that there are a number of individuals who have chosen not to go into shelter for any number of reasons. They may not feel safe, they may not feel welcome, and the use of individual rooms and bathrooms really provides that extra level of safety and security. In addition, right, the staffing for non-congregate shelter is there to protect the individuals in shelter. So it really provides them with a space to heal and thrive, and really reduces the additional trauma or re-traumatizing of individuals. We also know that it provides improved health because there's less opportunity for communicable diseases or pests to spread. So as we saw with COVID-19, but we also, if any of you, I know we have some shelter providers here, if there are lice or bed bugs, that also just spreads, is like wildfire in congregate settings. And when you have non-congregate shelter, that does not and is not necessarily the case. Next slide, please. So during the height of COVID, as we talked about, most communities prioritize those who are most vulnerable to severe illness and death from COVID for units in non-congregate shelter. But we know that the emergency prioritization measures are going, and the emergency sort of state of affairs will be ending later on this year. And we know that a lot of resources that at one time were paying for hotels and motels or other dormitory style buildings have been reduced or have been used up. And so you all will have, as communities, limited resources to use non-congregate shelter. And so you therefore face the challenge of determining which households will be prioritized for non-congregate shelter. What we want to talk about today, and I'm going to turn it over to Nora in just a moment, is that we have to be really intentional about creating space for these conversations. What is vulnerability? What does vulnerability mean? And as we have these conversations, ensuring that all voices at the table are represented, valued, and heard. So really making sure that we have the voices at the table that need to be there. And that very much includes people who have experienced the system, in addition to people who are working within the system, but ensuring that all voices are heard and respected as we have this really difficult, I think, and complicated conversation around prioritization. With that, I'm going to turn it over to Nora. It looks like there may be a question in the chat about staff training. We can talk a little bit about that later, maybe in our Q&A session. So I'll make sure, Jerry, that we come back to that. So Nora, I'm going to turn it over to you.
Sounds great. Thanks, Ashley. So I'm just going to walk through, I think Ashley queued up really nicely, right? What communities have to be thinking about if you are going to continue having non-congregate shelter or start a non-congregate shelter project in your community. It's going to be limited, right? And folks are going to want access to it. So I think there's no right way to prioritize people for non-congregate shelter. It's really a community decision. We're just going to be walking through some examples of things that you can consider or strategies you could use or kind of pitch to your community. But again, I think for a lot of folks, it may make the most sense to prioritize folks the same way you do for your congregate shelter, right? Which is typically first come, first serve, or a wait list, right? A lot of congregate shelters in larger cities or in very small cities with few beds will use a wait list format. So we're going to run a lot of creative and a little more complex possibilities for prioritization, but you're not required to do it that way, just things to consider and to talk about with your community. And so today we're really going to focus on prioritizing for non-congregate shelter to further equity. We're going to talk through some examples of how you could also do it based on vulnerability factors, similar to how coordinated entry is typically run, or focusing that resource really on hard to house populations, just to get your brains going, and hopefully some ideas will resonate for you and your community. So a couple of considerations for prioritizing to further equity or eliminate disparities. Prioritization schemes, and I think HUD and HCD have produced a number of documentation or guides, right, on really how you can focus prioritization for coordinated entry on serving groups that are historically underserved in your community. And I think, a lot of the same lessons and information are applicable to prioritizing for non-congregate shelter in your community. A big takeaway from a lot of those documents, right, is that prioritization schemes can consider groups and populations that are disproportionately experiencing homelessness or underserved by the COC, including BIPOC populations. However, HUD and HCD does not permit explicit prioritization of households based on certain legally protected characteristics, right? So things like race, national origin, sex, or gender identity. But there are still approaches that address inequities in your homeless response system that you can use to make sure that you're really serving populations, again, that have been historically underserved or are experiencing disparities. So I want to walk through a couple more slides and then I'll open it up for questions if folks have any on this particular topic. But something to really consider if you do have a vulnerable population that you want to target for non-congregate shelter is basing your prioritization scheme on what's called targeted universalism principles. And I'll run through a definition. I think it's best understood really through an example. But the idea of targeted universalism means setting a universal goal that can be achieved through targeted approaches. So within a targeted universalism framework, universal goals are established for all groups concerned, but there's sort of a targeted approach that may be of particular benefit to a certain group, right? So it's like a middle ground between policies that benefit everyone and targeted policies that seek to sort of exclude, right? So again, I think it's best understood through an example. I would consider this to be a really good example of how targeted universalism can work for prioritization for non-congregate shelter. And this is an example I've worked in some communities to help them execute a similar process. So let's say your community has a disproportionately high number of Latinx folks who are experiencing homelessness. Like when you're looking at the census data, when you're looking at the number of folks in poverty in your community, and you see, hey, we have a really high disproportionate number of Latinx folks who are experiencing homelessness. Prioritizing folks in the community who are Latinx, right, for non-congregate shelter might violate, likely will violate applicable laws and regulations. So really thinking about how to target that group without explicitly targeting that group, right? So one thing I've seen communities do is like, for an example, if there's an encampment that has a number of people, both Latinx and not, but has a large population of folks that are Latinx and are, let's say, monolingual Spanish speakers not engaged with the continuum of care, Targeted universalism would be targeting everyone in that encampment, right? So it's not excluding anyone, but it is focusing resources also on an underserved population and might help reduce disparities and access issues for Latinx folks in that particular community. Does that example make sense? Do folks have questions on that? Please feel free to put them in the chat or raise your virtual hand. Okay. So I think another thing to consider is prioritization based on specific vulnerabilities. And I think there's a lot of overlap with prioritization to further equity, right? But there's also ways that you can leverage sort of existing frameworks in your community to figure out how you're going to prioritize folks for limited non-congregate shelter. So a really easy way to do it, right? Not necessarily the best way, but one way to do it would be to prioritize based on your VA-SPDAT scores or your community assessment tool for coordinated entry, right? So you could do it based on the raw score, if that made sense for your community, or factors like length of time homeless, severity of service needs, things like that. Another example, a more targeted example might be that I've thought through is thinking about a particular question, right, that's on the VA-SPDAT or on your community assessment tool that is indicative of a specific vulnerability, right? So let's say, for example, that you have data in your community that shows that victims of domestic violence are more likely to experience homelessness and are more hesitant or don't feel comfortable in a congregate shelter setting. So a way to sort of screen or prioritize folks who have a history of domestic violence or are currently experiencing it is pulling a question, like for example, on the VA-SPDAT, there's a question that gets at if the person has experienced emotional, physical, psychological, sexual, or other types of abuse. So if folks answer yes to that question on the assessment, that's a group of folks that you could potentially pull from for non-congregate shelter. And Jerry, I see, was VA-SPDAT found to be lacking relative to some equity subpopulations? That is a whole other conversation, which I'm glad Ashley is taking the lead on answering. But yes, many communities are moving away from the VA-SPDAT. I will say creating an equitable tool that's based on vulnerabilities is very, very, very challenging. And I think whether it's the VA-SPDAT or another tool, it's important to constantly be, and we're going to talk about this in a second, looking at your data, looking at your outcomes and seeing if there are subpopulations that aren't being served, there are disparities being created, and making adjustments based on that data. And really, I think the efficacy of any of those tools is going to be through that constant evaluation and feedback processes. Any other questions? Great. So another thing to consider is focusing your non-congregate shelter resources on hard to house populations. So for example, folks experiencing chronic homelessness. And another one I've seen I wanted to give an example of are 290 registrants or people who are registered sex offenders. So one community that I worked with actually did, and we heard actually some feedback after the last session, non-congregate shelter session, that folks wanted more information on how to effectively shelter and potentially house registered sex offenders. It can be very, very challenging. It's a question that comes up a lot for me as a TA provider. And so one community that I work with pretty closely actually did use a certain percentage of their non-congregate shelter or put 290 registrants in their prioritization scheme for non-congregate shelter because it was so challenging to get those folks into congregate shelter, right? Because maybe it's close to a school or maybe folks have restrictions in their parole or probation that precludes them from being in certain spaces. So that is something to consider, right? If you have a particular population that is very challenging to house, thinking about, or shelter, thinking about how that population could potentially be prioritized for non-congregate shelter. We'll say if that is an approach you use with 290 registrants, really important, and Ashley talked a lot about this in the last session, and hopefully we'll have some more time to discuss today, making sure you have specific safety and logistical considerations in place and that your staff are trained and you just have the infrastructure in place. Yes, Jerry, agree. Registered offenders and arsonists are super hard to serve, especially as they become more vulnerable with age. It's very, very challenging. So this is just one idea. Again, not something to consider, but not something mandatory to implement, right? So I wanted to really quickly do a Jamboard activity, just to kind of get a sense of, for the people on the call, if you're considering non-congregate shelter for your community, what you've considered in terms of prioritization. So I will pull up that Jamboard to share. Ashley just put a link in the chat to the Jamboard. If you haven't used Jamboard before, go ahead and click on that link and I will walk you through how to engage with the tool. Is that link working for folks?
It's working for me, Nora, so I think so.
Perfect. Okay, so if you haven't used Jamboard before, you'll notice on the left-hand side, there's a little toolbar. And right in the middle, there's a little icon called Sticky Note. So you want to open that up. You want to type your answer, click save, and then you can move your box under both of these questions. So what I'm going to ask you to do now is do a little sticky note and let us know, do you have a hard to serve or vulnerable population that might benefit from non-congregate shelter? And if so, which population is that? I think that will be helpful for our conversation moving forward. If you're struggling with the Jamboard, definitely put your answer in the chat or come off mute. That works too. So I'll give you a second to do that. Eleanor, I see it requires, yes, perfect. Exactly. Yeah, this is great. It's interesting that more than one person is thinking about 290s, seniors, elderly population. I think there's some tricky things about prioritizing based on age that can be a protected class. During COVID, there were emergency measures put into place where prioritizing seniors was permitted because they were a vulnerable population for illness. So I think that if that is something your community is thinking about targeted universalism policies, right? So if there are particular physical or mental illnesses that you see affecting an elderly population, trying to screen for that as opposed to just a screening on age. Does anyone want to come off mute and talk a little bit about their population or what they're thinking? Like, I would be particularly interested to hear from the folks who are thinking about prioritizing or have a vulnerable population of elderly or seniors, older adults. If anyone's brave enough to come off mute.
And Nora, I'm just wondering if the person is willing, who wrote lack of interest in caller, to answer a bunch of questions to get to prioritization. So I'm not sure I understand, but maybe you do. So it'd be great to have a conversation.
Thanks, Ashley. This is Amber. That was actually me. I think that in order to, we talked about a way in which we could create a prioritization for the folks who were seeking shelter that were currently living in public spaces. And I know, again, that process is being overseen by a federal magistrate currently, but part of the difficult thing for us was really determining who is the most vulnerable. We have no shortage of vulnerable people. And in order to determine who was the most vulnerable, it would take a lot of, it would take us asking a good amount of questions. And that is something typically that people are less than comfortable with. Also, to capture that information when a person is available and interested in sharing all of that information was also something that was a struggle for us. So we went to just simply a call-in line where we asked people to leave a very small amount of information because it just felt overwhelming when we started to imagine what we could ask them and how we could develop what the priority populations would or would not be and why.
Yeah, that makes a lot of sense. I think that's something that's like a balance that many communities are struggling with, right? Like, how do you get the information you need to prioritize without completely overburdening people and like re-traumatizing them, to be frank, answering a lot of these personal questions. Wondering if anyone else has had experience with kind of striking that balance, who could jump in and respond to Amber's comment. Like, I'm seeing another comment that says serving only the most vulnerable concentrates the hardest to serve in an overwhelming setting. Thus, a mix of vulnerability should be discussed. That's a really interesting point. Can you say more about that? Or in the chat?
If I can get my I have this thing with Zoom where it blanks out the screen while I'm trying to click. So yeah, so and it goes back to the VI SPDAT question as well, is if we put all of the most needy people in the same place, the concentration of services that we need to have in that place increases dramatically. And given our staffing mixes, we don't want to do that to staff because then we burn out the staff. And then also some of the people in that concentrated setting are going to get underserved because of the highest vulnerable are going to get the attention on any given day, is my thinking. And then the other is that if we're trying to create some kind of a community, we have to have a community value, and one of the core community values that we should promote is mutual support. And so if you have some people with higher vulnerabilities and some people with a medium level of vulnerability, so to speak, we would then be able to, they would help each other. And the act of helping each other invigorates both the life of the community in that location, as well as the individuals, because it's so important to give back and to be a helper at the same time as you're a receiver.
Yeah, those are great points. I'm wondering, Ashley or Donald, if you all have had any experience working in prioritization schemes where there was like a spread of different levels of vulnerability and how that worked.
Yeah, I would love for Donald to talk about this too. I've talked about it not in the sense of shelter, but in the sense of just affordable housing in general, and thinking about how you create community in like a permanent supportive housing project. So, Jerry, you bring up a really interesting point. And I think it's a super valid point. I can only say sort of two things to that. One, we've seen incredibly vulnerable people. There's a place called Center City Housing that's based in Duluth, Minnesota. And they have created a number of projects that are harm reduction focused, right? With people who are chronic inebriates, folks who have incredibly challenging substance use disorder. And where everybody is actually very high need, and it has worked really well. I think the key, of course, is the staff to client ratio, right? So, I mean, when you are working with folks who have severe mental illness and other challenges, you're going to really have to think about the level of acuity that people have and the number of staff that you need to adequately and actually successfully staff that. So it looks very different to me than some of the ways NCS has been set up, where, you know, someone goes and checks. Like that will not fly. We have to really think about it more from I think about it from like an assertive, like an ACT team, right? The team that really rallies around 1 to 8 individuals. Donald, it sounds like you might want to say something.
Well, a couple of things. First of all, just kind of ways to kind of avoid any kind of fair housing violation with prioritization. What a lot of communities have moved to is more of a composite score. So bringing in some other databases or other connected practices or connected issues. And sorry. Some communities have added things to a composite score using a prioritization tool. A lot have moved away from the VI-SPDAT, but adding things like criminal justice involvement or involvement in, and there's actually a whole line of programming around looking at lethality as a measure, as a predictor for vulnerability versus looking at this scoring system. And I know HUD is working on many different ways to address this in a way that is fair and allows the community to prioritize the highest need, but not run into any of those legal issues. As far as what the gentleman was talking about with respect to kind of having a lot of people in the same facility, I think that was how in the beginnings, the model of primary supportive housing was created. So it was more of a community setting with 24-hour, at least property management, and then all day resources for case management and income and the other supportive services that were necessary. I think the country as a whole has gotten really used to the idea of a scattered site model, which can work, but I think there are some people with such high levels of behavioral health that they can't survive in those locations. So I think we have to look at models that embrace all different levels along the spectrum of behavioral health. And one thing that you also talked about is the mutual benefit. And in our project in Orlando, when we housed the 300 hardest to serve, some had been on the streets for 30 years. We really were heavily invested in a peer support model. Yeah. So not only did everybody have an ACT team, they also had a peer support component. And it really, to me, was the most important element to the success of that project. And I think that the more we as a sector embrace the idea of mutual benefit and peer support, the better our outcomes are. So I really think that you hit on something that's an element that isn't fully utilized that could have tremendous results for people in programs. But I do also think, and we'll talk about this in the best practice model later, the marriage of a FQHC, Federally Qualified Health Center, and a housing program to do permanent supportive housing is really one of the best practices that you can possibly find, because their support goes beyond even an ACT team. So I just wanted to raise those issues, and Nora, I'll give it back to you.
Great, that's just a ton of helpful information. So thanks for jumping in with that, Donald.
It looks like Jerry wants to say one last thing.
So just a final point, or Donald, you're wonderful. All of you are helping. But the FQHC is there's an element where they're not in healthcare. So they're like the core or one of the base foundation supports, but using the peer support as well as the best permanent supportive housing models is a piece. So they're a piece of the pie, some large piece of the pie, but these other sort of support structures of various kinds is also what we need to strive for and help and define that so communities throughout the country can understand that it's pieces of a pie that make the whole circle, so to speak. Thank you.
Absolutely agree with you.
Love that. Thank you, Sion. One other sticky note that I had questions or I would love to hear more about is whoever put, if the regulations get in the way, then they should listen to the field rather than forcing the field to fit regulations, which are wrong. Can whoever wrote that come off mute or put in the chat?
Yeah, that's
is that
me.
you, Jerry?
I texted Teddy this morning to say, I'm feeling cranky this morning, so if I go overboard, remind me. So again, so many, I mean, regulations were written ostensibly for good purposes, but when they start to get in the way of what we in actual experience, especially as like experienced professionals, we identify things that need to be fixed. We can change regulations if they're in the way. Even the most fundamental important protective regulations can be tweaked, but we have to say it out loud. Just like the whole idea that housing first only works if it's truly housing focused. That's an evolution that we've gone to. So it's that was my kind of point, is that regulations are not cast in stone.
Yeah, that's a really great point. And I think that, again, sort of back to what we were saying about the VI SPDAT and like the framework of a community assessment tool, like that's something that a lot of communities are struggling with. And the answer, right, is more conversations, right? More conversations and recommendations based on what's going to work for the community. So one thing I'm noticing, and happy to talk about other things that are coming up for people looking at these answers. But one thing I'm noticing, and that I just want to emphasize, and I think Donald just touched on this as well, is some of the categories of populations that might benefit from NCS, I think, are totally valid, right? And likely very much makes sense in the context of your community, right? We know LGBTQ+ populations are uniquely vulnerable, seniors, folks that are experiencing mental illness, families, reentry populations is another one. But I will say, I think that, and this issue gets to be complex, so definitely lean on your individual community resources, including potentially county council, but really trying as much as possible, like for example, not to prioritize people based on a certain category, right? A protected category like sexual orientation, gender identity, that's a protected category. So in your policies, you couldn't say, right, like we're going to prioritize people that identify as LGBTQ+ for NCS. But what you could say is that we're going to base our NCS on certain vulnerabilities and then try to target the vulnerabilities that are uniquely affecting LGBTQ+ populations, right? Like, or people that maybe don't feel safe in a congregate space, or other sort of, again, like vulnerabilities that are unique to that population. And I think that that's sort of what tools like the VI SPDAT try to do, but that's just something to consider, right? So like trying to reframe, having in your mind the populations that are vulnerable in your community, and then trying to figure out how to target those populations based on vulnerability and unique experiences, as opposed to a protected category or class. Does that make sense? Or do people have questions on that? All right, well, I'm going to stop sharing this screen. If you do have more questions about a particular population that you are thinking about prioritizing, but you're not sure if that's going to jive with some of the restrictions that either your community has or the state or federal government have, then that's something that we can definitely provide more resources and chat about more. I would also put in a plug, because I did it last time as well. ICF and HCD are offering free technical assistance through this same project for individual COCs and communities to take advantage of. And so again, that's something that potentially you can get free assistance to help think through. One other plug I wanted to put in, and I feel like I've already said this about 30 times in this presentation, but really, really, really important to continue to evaluate how prioritization is working. So whether you're doing a first come, first serve model for NCS, or you're doing one of the more nuanced, like focus on target populations for NCS, really important to continue your reviewing your data, right? To make sure that you're furthering equity and you're not creating additional disparities. And that's something that could potentially be built out as part of a coordinated entry evaluation or just other ongoing review process. I think it's really hard, when you're working in direct service or, you're doing a million things for your COC to set aside the time to do this, but it's really, really important. And it's really the only way to ensure that your community is furthering equity. Also, just wanted to emphasize again, prioritization decisions should be made through community discussions based on both quantitative and qualitative evidence, right? So leveraging any feedback loops also that you have in your community with folks with lived experience to really get a sense of a deeper qualitative evidence to support your community decisions. And also, collaborating with people with lived experience of homelessness to design these policies and make these decisions is really, really important. COC also needs to be transparent and consistent about these practices through both policies and procedures in organizational policies and at the COC level, right? Like, I think that HUD and HCD allow a lot of flexibility in how you're going to be prioritizing people within the constraints of some federal and state requirements. But your policies need to show what you're doing, right? And I think it's hard when, again, things are moving fast to take time and to set aside to write your policies, but it's really, really important. And it's something that HUD and HCD will be looking for. And just, I'm not going to go too into this slide, but this is sort of an overview of the flow that we talked about, right? So when you're identifying a prioritization scheme, these are the big steps you want to take. You want to look at your data, quantitative and qualitative data, identify based on that what the system gaps are, what the needs are, including if there's any existing disparities or inequities. And then defining a target population that's responsive to those system gaps and really thinking about those targeted universalism principles when you do that. And then ensuring that serving your identified target population is furthering equity and not perpetuating disparities, which is sort of that evaluation and ongoing feedback process. Any questions on prioritization before I'm going to kick it over to Donald in a second to talk through an example of a community that's standing up non-congregate shelter and thinking through some of these issues. But any questions, final thoughts on prioritization before we move forward? Oh, Teddy, go ahead.
Hi, sorry about that. Do you have any actual examples of like scorecarding or evaluation frameworks that you use for this purpose that you could talk about or show?
Yeah, I think that I don't have them to show you right now, but what I would say is that it's going to look similar to does your community do a coordinated entry evaluation?
Not quite yet.
Yeah. I think a lot of people are kicking off that process now since things are like settling down a little bit from the last few years of nonstop activity. But It's really about working with your COC to define a specific data request that's going to look at sort of what you are trying to assess. Like, I think with what I would probably do as a starting point is look at sort of the racial and ethnic demographics of my COC. Also look at other demographic information, including like disability, age, some other things, and then sort of compare that to what the general population looks like, right?
Okay.
So like if you have a pretty diverse, a racially diverse community, but you're seeing all of the people in your non-congregate shelter are white, right? And that's
Right.
not representative of the general population, that's something to flag. So we do have, and again, Chris, maybe you can put the contact information in the chat, but if your community could benefit from really like getting some templates of what those data requests look like, or what types of qualitative questions you can ask, and sort of like an outreach plan, that's some resources that HCD could potentially provide through that TA opportunity I was talking about. So
Mhm. Okay, thanks.
yeah. Other questions? Okay, great. I will kick it over to Donald.
Thank you, Nora. We're gonna just give you a overview of a community that has embraced the idea of congregate shelters and actually put the idea into action. We had to first find someone or some community that was had the same resource level as California, who a state where there was resources that were this is a challenge when it comes to being able to do it because of the level of resources necessary. And the place that probably most closely mirrors California in terms of resources is Colorado. And this is a unique organization that actually has collaboration, kind of what I was talking about earlier. They are not only a healthcare for the homeless facility, they're also a housing development and homeless service provider organization, and really have done a great job of embracing the idea of non-congregate shelter and actually continuing it post-COVID. So this is the Colorado Coalition for the Homeless, and the title of their presentation is Hotels to Housing. We had hoped that Kathy Alderman, their Chief Communications and Public Policy Officer, would be here, but unfortunately she wasn't able to. She's also a board member for the National Low Income Housing Coalition. So we're going to jump right in. So the Colorado Coalition, again, they're a multifaceted organization. They serve 15,000 people through their healthcare work. They house about 4,300 people yearly, and 20,000 people are served yearly. And they also, in addition to all of this, are very prominent in their community when it comes to advocacy and education. So why hotels to housing? Using motels and hotels for people experiencing homelessness is effective and an efficient way of making more housing resources available more quickly. It is a lot quicker to use a hotel and use some adaptive reuse policies than it is to build something from the ground up. The buildings can either be converted into studio apartments in much less time than it would take to build from the ground up, or they can serve as transitional housing options, bridge housing, and other kinds of transitional for people while they wait for longer term housing resources. Recently, hotels and motels have been lifesavers for individuals experiencing homelessness because they provide safe, stable places for people to recover from COVID or to be protected from COVID transmission in congregate settings like shelters. We've just heard how dangerous it is when it comes to disease for people to be in those congregate settings. Repurposing resources that are already available but currently under or non-utilized means that more people experiencing homelessness will be able to get into safe, more private spaces more quickly, which will hopefully put them at a path to longer-term housing stability. So hotels to housing, non-congregate shelter, pre-COVID and currently they're buying hotels, transitional bridge housing, rebuilding and converting those into studios. COVID transformed motels into non-congregate shelter. 800 Denver hotel motel rooms were activated for respite and protective action, serving roughly 5,000 people. Transitions were also made from hotel and motel sites to permanent housing. Moving forward, transitional housing and non-congregate shelter, residential and respite care, long-term housing and studio apartments are all part of the plan to continue the hotel to non-congregate shelter conversions. So here's a couple of examples. The Fusion Studios was converted in 2019. It was a 6-month conversion and they converted that hotel to 139 studio apartments. The Park Avenue Inn was a direct COVID response and they plan to tear down this hotel and actually convert it to 200 units of non-congregate shelter. The Clarion Hotel, this was a $24 million project, 21 million in cash acquisition, 400 million for the immediate renovation. The hotel itself closed December 22nd, 2022. It became 108 units of supportive housing, long-term supportive housing, 107 units of transitional housing, intensive support services for highly vulnerable individuals with chronic health conditions, mental health issues, trauma, and other disabilities. So permanent supportive housing is what it became. It also was used as bridge housing as people moved into permanent supportive. So if you want to get more information about those projects and other projects that the Colorado Coalition will be embarking upon, you could contact Kathy Alderman. There is a fantastic study, and I think one of the things that in the study that I think is important to highlight is that one of the things that they stress is that everybody can't do this. And one of the things that made it really doable for Colorado is their experience with housing development. So I think Gary touched on this earlier. In order to do this in your community, it will probably require some collaboration with somebody who's more versed in housing development. If your organization isn't that organization, it is expensive to do this, but it's doable. And as was mentioned before, there are resources within HUD to help with this. Other resources that we didn't mention are the McKinney-Vento Title V resources that allow for buildings that are owned by the government to be converted to housing units. One really great example of that, if people want to look at this, is the Alameda Point Collaborative. They've taken a decommissioned military base and transformed that into permanent supportive housing in a non-congregate setting. So there are other resources on the table as well, in addition to those that we've mentioned. Colorado, they have gone full sail. They started with a couple of hotels that they converted to SROs, and they've continued to do that. Thank you for putting the Alameda Point Collaborative in the chat. So there are a number of ways that this is done. I think Colorado and some of the others that we have identified through the course of this training are really, really exceptional examples, but there are others sprinkled across the country. It really is a really important way to really address those issues. And it also addresses some of the other issues we identified from people experiencing homelessness. And those were things like safety and additional case management services. A lot easier to do that in a non-congregate setting. I'll stop there and entertain any questions you may have. And we'll take down the screen and stop sharing. And if anyone has any questions, I can certainly answer those. And actually, we all can answer those. And if you don't want to speak out loud, you can certainly put those in the chat. And Ashley, I think I'd turn it over to you if we don't have questions.
Yes, thank you so much. I'm going to give everybody just a minute and then let's just, then I will follow up.
Well, we wanted to get back to the staff training issues and staff development issues if either today or next time.
Yes, thank you, Jerry. I have a very short memory, so I'm very glad that you brought that back up. Chris,
can I
if you, oh, I'm sorry.
Ashley, do you mind, Gary, if you could like clarify exactly where you're going with staff training? Is it for a non-congregate facility or just training overall? I just wanted to make sure we got that.
I think for the non-congregate facilities and what we have here, which is an interim site in Sebastopol, but it's true of shops as well. So your general ad is like, so we have.
Gary, you're breaking up a little bit.
Okay. So basically we have staff who have a variety of skill sets, and we have a population that has vulnerabilities and particular attributes, and we're trying to develop community. I want to I'm working on a project to help one of our non-congregate sites, the RV training site in Sebastopol, trying to help them bring new staff in and successfully help the residents. And the complexity of 40 people, or in Victor's case, 170 people, is super complicated. And the frontline staff are the people who are with them. And so what you all have a wealth of knowledge, and I want to sort of draw your attention to the specific frontline staff training or development needs that make them most successful in working with the residents.
Mm-hmm. Thank you for kind of going in depth about the training that you were talking about there. Chris put in the chat, there's a number of trainings that have already been done with ICF. And Ashley actually also put in the chat, there's one in particular on case management. I know we've done trainings on trauma-informed care. We've done trainings on helping staff to be able to embrace people with lived experience. And so those are some things in that training menu that you could certainly utilize when it comes to helping those staff members be ready to go when it comes to working with people with lived experience.
And if I can just add one thing, Jerry, that on that best practices one, so I was a part of that. We looked, so it's a series. I'm going to make sure I put all of the series in here. I'm looking through the training site as we're talking, but we really talk about what your focus needs to be in shelter. We need to, and then we talk about what the focus needs to look like as you are putting people into rapid rehousing, and then once they are in rapid rehousing. So really looking at that continuum, but case management looks very differently in all of those spaces. So just wanted to make that little plug right there, that you will see a variety of different sort of the context that you're asking for, specifically around non-congregate shelter. You can get some of that in that particular training.
Thank you. I knew you'd have it.
And I would also really heavily emphasize the trauma-informed care training as well.
I know after our last presentation, people had a number of sort of ideas and things that they wanted to talk through, including sort of how to implement harm reduction practices in non-congregate shelter, and there were some other topics as well. Does anyone want to circle back on any of those? We have a little extra time. So if there's questions about, if your community is considering a non-congregate shelter project and you're having issues standing it up, we're happy to talk through that, or anything else that would be helpful. All right. Ashley or Donald, do you have any last words or anything else you wanted to cover before we hop off?
I would be curious if there are communities who did stand up a non-congregate facility, but have had to move away from that because of the kind of drying up of those funds from the CARES Act and other COVID relief funds. Is there anybody who has had that experience in their community? Well, that's awesome. We're glad to hear that, because that is certainly a challenging situation for people with lived experience.
I wanted to just also say, Jerry, in that link I put in around from the disaster response rehousing, there's a number of community examples around staffing. So that would be another good place to look.
And there's also just a number of trainings that actually touch on some of the issues around racial equity and making sure that there's that kind of training for staff as well. So I encourage you to go through. There were some really excellent trainings that were done last year, and there's a link to a whole series of different kinds of trainings that you can actually replay for your staff. I think it's a really good place for you to get as much information as you need. Not all of it is targeting kind of a non-congregate model, but I think you could certainly apply some of the principles to any model that serves people with lived experience.
Can I make one sidebar comment as we're closing, which is, as you all, it's about web clipping and clipping the links in the chat. So as I use Evernote, but I'm certain that Microsoft or Apple has the same product, but basically that, when web links are put into the chat, I'm like immediately opening those items, and then my Evernote web clipper, I can clip them. So I have, you have all of these notes and all of this sort of references that are being made. It's a really convenient practice in webinars like this because there's so much to absorb. So if you use Evernote, there's a free and a professional version. They have a web clipper, and then you can actually clip links that are put into the chat and save them. So for anybody who doesn't know that, that's what I'm doing as you all are talking. I'm also saving all those clips.
So
Thank
cool.
you.
Looks like Teddy had a question as well.
It's more of a comment. I do just want to stress how well these trainings have been done over the past year and a half, whatever they are. And if your community hasn't already taken advantage of these, I would highly recommend doing it. And something that I believe we spoke at a couple days ago was maybe putting some of these questions in local NOFAs about how do you train? What's your training and development program for your staff internally? And that would, I've just come up with that idea based on your learnings here the last couple times, which is, don't tell me you do it, but tell me how you do it.
Mhm.
And include it in your NOFA, simple thing, when you ask what your case management ratio is, ask what's your internal professional development program if your COC doesn't have such a thing like that. And it would be totally fair for people to ask for funding to do their own training and development internally if that's what it took. But I think that providers don't really, everyone's so busy and overwhelmed. I don't think providers think that way until it's kind of right in front of, of all of us. So just thought I'd add that.
One thing that I've also thought about, Teddy, in that space is actually tapping into, because a lot of these groups are nonprofits, tapping into the board for fundraising specifically for that, because admin dollars are so few and far between.
Yeah.
But it is so critically important, especially as we think about professional development. So I have always tried to encourage people to look at their boards as not only giving significant contributions if they can, but helping to fundraise for that particular line item.
Yeah, excellent point. Or your local foundation. I know ours in the past has funded, similar efforts, but training is an ongoing proposition, right? You don't just do one training and boom, you're set to go. That's one thing I really loved about Alameda County was they have a very dedicated professional development program and it just keeps going. So with peer support. So it's super important, I think, to do that, especially in the case management role.
Great. Well, if no one has other questions and we can end a little bit early, I think just want to plug to Chris put in the chat a few communications back the ICF training site. And thank you, Teddy, for the shout out on the trainings and how helpful they've been. So if other folks want to use that resource for your community, please, you can find all the trainings that we've been doing on that site. But we really appreciate your time today. We hope this was helpful, and I will kick it over to Chris to wrap us up.
Thank you, Nora. Thank you, Ashley and Donald as well for the presentation today. And thank you all for joining and attending this California Housing Community Development Workshop session offered through the Emergency Solutions Grant, Coronavirus Relief and Consulting Staffing Services Contract. Look out for more information on our next training sessions. Use the training site that's in the chat. When the session ends, a 4-question survey will pop up. Please do answer that. We look at that every week, and it does direct us on which direction to go. So if you have things to say, we will listen. With that, have a good rest of your day. Good seeing everybody.